area too, yeah. If I lift it a certain way, it's just, I want to cry. It hurts so bad. And just the same area, you know, right in the rib cage, right where the sternum is. If I up in here, I mean, it just irradiating, like agonizing pain. And
aside from the pain, do you have other symptoms?
just angry all the time. But nothing like throwing up or anything like that. I'm nauseous constantly, but that's something that I've always dealt with. And also up in my head here, it's like a numbness or like it shooting down, and then in on this side of my face, it just feels like weird. I don't know, but it's been like that. I just never mentioned it before. It's something I've had consistently. But I had head trauma. I was thinking about it like 3 years ago when this all started. I got hit in the back of the head with a stick really hard, and I don't know if that caused any kind of blood clot or something like that, or any kind of damage to my head or my nerves, and that would end up shooting down here or up here. I have no idea. But I never mentioned that before because I never thought that that would correlate, you know? Like,
So, okay. So, the chest wall pain, it sounds like you've had an x-ray of your chest that was normal. It
Yeah.
sounds like you've done a stress test that was also normal,
Yeah.
but you're still having ongoing pain.
beyond, yeah. I mean, every day of my life, I'm just 8 to 10.
Okay.
And I ride my bike. I got on my bike again past 5 days. I haven't been doing anything. You know what I mean? I'm just trying to lay there, relax, hoping that it'll go away and I'll feel better. Nope. So I said, fuck it. I got on the bike the past 4 or 5 days because I'm sick of, I gained weight, you know, trying to lose it again. And it's just like, I don't know if from being on the bike like this and riding it for so long that did like permanent damage up in here or whatever. I mean, this isn't just normal aches and pains. I mean, something is not right. You know, I don't know what it could be. That's why I wanted MRI just to see what's going on, and then like maybe check the head up here too for a blood clot or something. I don't know.
So, it wouldn't make sense that you had a blood clot in your head that isn't reabsorbed by this time if the injury happened 3 years ago.
Okay.
And there's a finite amount of space in your head. So if you had a blood clot that was significant enough to cause these symptoms, you would have ended up in an ICU and we would have found it.
Okay.
So I don't know that that's necessarily, you know, a structural problem in your head. Sometimes people develop occipital migraines or trigeminal neuralgia that can cause this.
Like it starts from my eye and then it goes back in here
Yeah.
and like down, goes down my neck, and it just feels like it's all connected with the nerves. That's all.
I mean, you could have like cervical disc disease, right? Like in the vertebrae of your neck or the
Yeah.
vertebrae of your thoracic spine that are causing the issue. But you would have to start with X-rays of your cervical spine and your thoracic spine.
Okay.
We can try to order a CAT scan of your chest to evaluate for, you know, what's
Because
causing.
if I breathe in really hard, it hurts like hell. If I breathe out really good,
So,
it hurts like hell.
The thing is, it sounds like costochondritis, and that doesn't have radiologic features. So
Okay.
if it is that, and you get the X-ray and the chest CAT scan, and it's negative, I mean, it's pretty certain it's costochondritis.
Right.
Your insurance may not approve the CAT scan of your chest unless you complete 6 to 12 weeks of physical therapy.
Okay.
But we'll cross that bridge when we get there. Chest wall pain.
Yeah, I just want to rule out anything serious. That's all. I mean, if this
But
is
your
something,
history rules out serious things.
right.
And the fact that you've had like a chest X-ray and stress.
But what would cause it to feel like something's ripping, tearing if I lift my arm up? I mean, it literally feels like I'm being ripped apart.
Costochondritis.
That would go in the arm.
Because the problem is that you have like your ribs are like this, and in between each ribs you have this kind of saran wrap that holds things together, and you have a bunch of nerves and vessels and stuff. So if that's inflamed and you go like this, you are going to feel this all along here.
Yeah, that's what it is.
The issue could be your thoracic spine and you have a pinched nerve or something going on here.
Yeah.
But typically people aren't going to say they feel it like that. People
Yeah.
are going to say it's coming across like this.
Yeah.
Or I have this one spot here. That's why I think that what you're describing to me at least is costochondritis.
Okay. Yeah, I think so too, but I just, I worry about everything else. I mean,
But I'm telling you that you shouldn't worry about anything else because your history doesn't make sense for
Okay.
other problems. Thoracic spine. Why can't I spell? So hold on. XR thoracic. Dude, what am I doing?
And that would be the same thing, like if I bend over, if I lean too much, I could feel it more and stuff like that. Like I realize like anything that's like causing for movement is not going to be the heart as far as I'm.
Yeah, because your ribs are doing this. If you lay back, they're stretching. If you move forward, they're compressing. The other thing is like pleurisy, right? So
Yeah.
like inflammation of the sac of the lungs, inflammation of the sac of the heart. But the CAT scan should tell us if that's present.
Right.
So spine, cervical. We
Yeah,
want
plus
that.
if it was that, I would think it'd be gone by now anyways on its own, right? It's like an infection.
Oh, if it's an infection, you'd be dead for
Yeah.
3 years.
But
Like,
I mean, the pleurisy, isn't that an infection of the lungs?
it's
Isn't
an
it?
inflammation
Oh,
of the
okay.
sac of the lungs.
Okay. And how do you get rid of that?
It depends on what's causing it. If that's present, then we have to do a bunch of blood work to figure it out.
There might have been markers though previous to the blood work I've
I would
had.
have seen something,
Okay,
and
yeah.
I haven't seen anything. But that doesn't mean it's not there.
Right.
I mean, let's take it one step at a time and kind of figure it out. The reason I make you come in is not for funsies. It's because for your insurance to
I
approve
got you. She
anything I
explained it.
order.
I'm sorry for being
That's
that.
okay.
It's so frustrating. I hope you understand. Like,
No, I get it.
be in pain like this, and it's like, it sucks. I have no quality of life right now. It's just.
Dude, I get it. Trust me. And I would not expect you to understand how healthcare works.
No,
right?
I get
You're
it
not-
now.
You're not doing
yeah,
this.
I thought you were like, no, I gotta see you.
Yeah.
And she's like, no, it's not like that. Your
Yeah.
insurance makes you see him, and then they can order this stuff. That's just how it works.
Because they need like to review your chart and make sure it's medically necessary.
Okay.
They don't just let me order whatever I want,
Yeah.
even though they should. But that's a different story.
Right. Yeah, I agree with you.
Um,
No one's gonna come in here and say, I want this for the fun. Give me an MRI. I really want to try those out. But that too, like if I turn my neck one way or the other way, like it aggravates, so that could be costochondritis.
No, that is, I think, a problem with the bones in your neck. I think it's arthritis in your neck.
Okay.
That's why we're gonna get a picture of it to prove that I'm right.
That's awesome.
Even though I hope I'm wrong, it's not awesome. I don't want to be right because you got to realize it's very limited what you could do to treat like degenerative disc disease of the spine.
Yeah.
You can go for injections, you can get a surgery done, you can take gabapentin forever, but none of those are honestly great options, right?
Now the gabapentin, that would help with it, or
So it won't help with all of your symptoms. The gabapentin would help like neuropathic pain, this like shooting sensation that you have going across the
Yeah.
face, or the hurting of your neck. If you turn your head and you have a zing that goes into your
yeah,
shoulder,
that's what it does.
it should help with that. But the costochondritis, really anti-inflammatory medication like naproxen or meloxicam,
Ibuprofen,
and so
yeah.
it's going to help the best for that. And maybe it's worth trialing a meloxicam for 14, 28 days, but I know you have a history of GERD,
Yeah.
and this is going to make your GERD way worse.
Okay. What's meloxicam?
Meloxicam is a prescription medication like ibuprofen, but it's a lot stronger. It's only dosed once a day.
Okay. Yeah, well, maybe later. I just want to try to do this stuff first.
You want to try to figure it out?
Yeah.
That's okay. I would try
But
to
I mean,
figure
it
out.
sounds like you know what you're talking about. Obviously, I'm not.
I would joke, but this is not the joke you want to hear
Yeah.
from your doctor. Fake it till you make it.
Yeah.
No.
No, I mean it does. Like I'm not. I don't know shit about medicine, but like I do my own research and everything else, and that's exactly what it comes back as every time. It's costochondritis or TENS-U or whatever it's called. It could be one of those
Well,
things.
which one?
TENS-U or something like when the bone breaks right down here that
Oh.
connects your sternum.
Uh-huh.
It snaps, and that could cause all the same thing. But
Well,
you
we'll
would
do
have seen that in the X-ray, maybe.
Correct. I hope it's not that, okay?
Yeah.
That don't sound great.
No, this isn't great either. So,
Your words, not mine.
it's awful, and it's just like it's just frustrating because I feel crazy. You know what I mean? Like I feel like I'm
Well, you're
losing my
not
mind.
crazy. I don't think you've gotten your answer to know what's wrong, right? We just need to do a couple of other studies to really make sure there's nothing else there. We need to see the arthritis in the spine, and then maybe you'll feel a little better.
Yeah. Now, is there special ways I should be sleeping at night? Because like because of the GERD, I sleep on my left side, which that means sometimes I actually sleep on my arm, which I'm sure is not good for the issues I'm dealing with.
To be honest with you, it's going to be so patient specific that I can't give you an answer.
Like, do you
one way
think
or
those pillows and stuff like you can get actually help? Like this?
it just depends on the specific configuration
Yeah.
of your arthritis, and like we really have no way of knowing that. You
Okay.
just got to try things until you find what works best for you. All right, my friend. CAT scans ordered. I ordered it without contrast. If the radiology feels like they need contrast to get an answer, then they'll just administer it. I give them permission to do that. Your kidney functions are fine, so you'll tolerate it fine. I ordered the x-ray of your neck and the x-ray of your thoracic spine.
Perfect.
You can do the x-ray of the neck and the x-ray of the thoracic spine on a walk-in basis like any other x-ray, but to schedule the CAT scan, imaging, you need to call the phone number that I dropped into your after visit summary,
Okay.
because they do require an appointment for that.
Okay. Awesome. And the other one I can just go and do today, right?
Mm-hmm.
Awesome.
And the U of R is gonna help me figure out like the prior authorization process and stuff, and I'll let you know about insurance coverage if I hear that it's not covered for any reason.
I'm fine if they have to bill me or whatever. I mean, I know it's probably thousands.
Yeah, it's like
sure.
$2,000-$3,000.
Yeah.
It's a joke, man, and I don't think it's worth it, to be honest
Yeah.
with you, getting that bill.
Yeah. No,
Okay.
it's a lot. Yeah. I appreciate all your help. Honestly, I'm sorry. I mean, I don't mean to be
It's not a big deal, man.
an ass or nothing. But thank you.
Yeah, I'll be here if you need me, and I'll be in
Awesome.
touch with your results.
Cool. All right. So all the instructions will be on the paper I'm gonna get right now, or just look at.
The phone number is going to be on the paper, and then it'll tell you that I ordered a CAT scan, and it'll tell you that I ordered the 2 X-rays.
Awesome.
The
Okay.
X-rays
Thank
you
you so
can
much.
just go to right now, and the CAT scan you call instead.
Awesome.
I'll see you.